morning. My name is Mary Leonard. I'm the chair of the Department of Pediatrics and the director of the Child Health Research Institute. Welcome to the Big Data Conference. Dozens of speakers have gathered here today from industry, academia, and the government to talk to us about digital health, cancer immunotherapy, artificial intelligence, machine learning, and rare and undiagnosed diseases. We are confident that this conference will lead to actionable solutions and new lines of research. This event debuted 5 years ago as Big Data and Biomedicine Conference has been a great success over that interval. This year, we've sharpened our focus and we've renamed the conference as the Big Data and Precision Health. For those of us at Stanford Medicine, from the School of Medicine, Stanford Healthcare, and Lucile Packard Children's Hospital, this makes perfect sense as we've embraced the precision health vision to predict, prevent, and cure precisely. Prediction and prevention are never so important as when we talk about children's health, and I've already talked to our first speaker a little bit about that issue. And when we talk about prediction and prevention, big data is always the next question. It's right at the center of the solution. Few people talk more passionately about precision health than Stanford Medicine's Dean Lloyd Minor, one of its most vocal advocates. Since he rallied Stanford Medicine to the precision health vision, it's permeated our classrooms, our research labs, the inpatient rooms, and the doctor's office with a shared focus and a common vision. After 3 years, his passion for the cause has only grown. Please welcome Dr. Lloyd Minor, Dean of the School of Medicine.
Thank you. Well, thank you very much, Dr. Leonard. Good morning, everyone. Welcome. It's great to have you all here today. We think we have an exciting 2 days ahead for you. As Mary mentioned, this is our 6th conference on big data, and we've renamed it. We've renamed it, as she said, to Big Data and Precision Health. And we did that for a number of reasons. One is that we do have this historic opportunity in front of us today to really embrace the vision and the opportunity of precision health. That is, to predict, prevent, and cure precisely. And really in that order, with a lot of focus on prediction and prevention, and yes, when disease does occur, to cure it decisively. But the same enablers that we've been applying in biomedicine to the treatment of severe acute diseases like cancer and heart disease, the enablers of genomics, big data science, regenerative medicine, those enablers can also be applied to prediction and prevention. And after all, wouldn't we all rather to maintain our health instead of always having to treat disease? Wouldn't we like to see a healthcare delivery system that was really focused on health care, not just on sick care? These are the opportunities and the challenges of precision health. So let's talk a little bit about prediction and prevention. They're going to be common themes throughout these 2 days. Some very exciting projects going on today, and you're going to hear in just a moment from Dr. Eric Dishman about the NIH All of Us study. Last year, we launched Project Baseline, a collaboration with Verily, formerly Google Life Sciences, Stanford Medicine, and Duke, and there'll be other participating sites as well. Baseline is a 10,000-person longitudinal cohort study designed to measure and track everything you can imagine about human health. Verily developed its own next-generation wearable for this study. And for the first time, from Baseline, and certainly in concert with studies like All of Us and many other cohort studies that are being launched, we'll have prospective information about health so that when disease does occur, we'll be better able to look back and say, well, maybe here were the early predictors and determinants that had we known that, we might have been able to predict and prevent the disease from occurring in the first place. We're also engaged in a number of collaborations with technology companies in Silicon Valley related to health. I'm just going to mention one of those today, and that is the Apple Heart Study. The Apple Watch today is the most commonly used heart rate monitor in the world. And wouldn't it be wonderful if we could use that monitor to detect arrhythmias? In particular, the most common arrhythmia, atrial fibrillation. Now, in fact, we don't really know the true incidence or prevalence of atrial fibrillation because it can be intermittent. Because we don't know the incidence and prevalence of AFib, it's really hard to make data-informed recommendations about the treatment for people who may have intermittent AFib. We hope that through the Apple Heart Study and follow-on studies, we'll be better able to make the diagnosis of AFib and answer the question of who needs to be treated, when, and how. This is a picture of Nigam Shah, professor of medicine in the Stanford School of Medicine. Nigam is one of the leaders in the application of AI and machine learning to the study of large data sets. So when we think broadly about the topic in the area of digital health, there are really two fundamental categories, related but distinct. One is consumer-facing devices and technologies that enable us or those around us to monitor our health in ways we've never been able to do before. And the other is the use of AI and machine learning to extract information from the treasure troves of data that exist about health and healthcare today. Data that, by and large today, are siloed and not accessible, and certainly not being subject to the type of informed analysis that can really drive better outcomes, better prediction, better prevention. Nigam's pioneered the development of algorithms in a number of different areas that's changing that. In one study, he developed an algorithm to predict the probability of readmission of patients who've been hospitalized for congestive heart failure. You know, today, a patient who has been hospitalized for CHF, who gets discharged and readmitted within 30 days, is not eligible for reimbursement from Medicare for the readmission. And after all, even independent of the reimbursement issue, shouldn't we be striving to, when people are hospitalized, get them in good shape and get the home health care services lined up so that they don't require readmission? So the algorithm that Nigam and colleagues developed can be used prospectively with patients in the hospital to determine what needs to be optimized in order to minimize the likelihood they'll need to be readmitted. And in another study, Nigam has developed an algorithm that predicts the longevity, that predicts the course of an illness of patients with advanced cancer. Not from the standpoint of saying that care has to be limited or curtailed, but giving physicians, other healthcare providers, and most importantly, patients and their families, a data-informed analysis of what the likely outcomes are to be, and enabling them, therefore, for the first time, to make decisions based upon information and reliable data, and not based upon anecdote. You know, we've seen so many advances in the past 20 years of translating fundamental discovery-based science into better treatments. My first patient when I was on my internal medicine rotation in medical school was a patient with chronic myeloid leukemia, CML. You know, even then in the 80s, we knew that CML was caused by a chromosomal translocation. But we had no idea of the gene product, and we certainly had no idea of how to effectively treat it. Now, through a beautiful series of work, CML has a 5-year survival rate of upwards of 90%. We've translated fundamental discoveries into advances in therapeutics. We'll continue to do that in medicine for sure, but we also now have the unique opportunity to make discoveries not based necessarily upon mechanistic analyses, but based upon the deriving information from the vast treasure troves of data that exist, and not necessarily relying upon hypotheses to be tested in that process. That's really the power of big data. In just a few weeks, we'll be sponsoring in this room a symposium on the electronic health record. Another example of the possibility of big data, but not one that's living up to its potential. Data is siloed and trapped in EHRs today, and EHRs are everything but user-friendly for healthcare providers and for patients. Now, I'm not pointing fingers, I'm not casting blame, but it's a problem. And shouldn't we be able to tackle and fix that problem moving forward? We're going to convene leaders from EHR companies, from CMS, from HHS, from the major national organizations to spend a day thinking about where we are today and where we can be and what we need to do either on the policy front or the design front to get from where we are today to where we know we need to be. The other opportunity afforded to us by the big data revolution is the opportunity to, for the first time, address the full circle of health, the full pie of health. We know that medical care and genetics accounts for only maybe a quarter of the healthcare pie. Social and environmental and behavioral determinants account for fully 75%. It's a sobering statistic that in the United States today, the most accurate predictor of lifespan is the zip code in which a person lives. That needs to change. And because of the connectivity that's brought about through digital devices, 80% of people on the planet will have a smartphone by the year 2020, or will have access to a smartphone. Because of the connectivity, because of the way in which data and consumer-facing devices related to data can be leveraged, we have a unique opportunity now to address these social, environmental, and behavioral factors in ways that has been very challenged in the past. Big data in precision health really will enable us to have worldwide impact. It'll enable us to bring services and technologies to areas of the world that have previously not been served by these services and technologies. And it should enable each of us as consumers in our own health environment to be much more engaged in our health and healthcare than we have been in the past. We launched a study last year called Human-Wide. It's being conducted in our Primary Care 2.0 clinic that's in Santa Clara. This is a clinic that we designed from the ground up to introduce innovations into the primary care environment. Small study right now, 50 people enrolled, but really looking at how we can use technology in the health care of these people that are enrolled in the study to maximize their engagement in their health and their well-being. And in so doing, to establish more fluid contacts between them and the healthcare delivery system. There's never been a more exciting time in biomedicine than today, and big data is going to play an exciting part of that future. Thank you all for being here today. Enjoy the conference. For those of you who are coming on the Stanford campus for the first time, welcome. We hope we'll stay in contact with you. You're always welcome to come back, and we look forward to sharing ideas with you. Enjoy the conference.